Well, tell us at this point where we sit with the mandate. You're in the process of writing it, is that right?
It's already written, and I've already submitted it to the state. But before we get into that, let me talk a little bit about the context here.
Okay.
Because context is everything.
Okay.
As you're probably aware, and it was all over the paper this morning also, and it's been all over all the news, we've had a explosion of cases in Wyoming in general, and in Laramie County also. Just an update on the hospital situation. I get an update from Cheyenne Regional Medical Center every day, and the situation as of today is there are 17 patients admitted there with COVID. 5 of them are in the intensive care unit. 3 of them are on ventilators. Some of those patients are transfers from other hospitals that are already maxed out and just can't take anymore. Hospitals in Billings and Rapid City are getting full. The hospital in Casper is getting slammed pretty hard. They got 8 or 9, maybe even 10 new admissions just yesterday. Some of the patients at CRMC are actually transferred in from other hospitals that couldn't take care of them or didn't have capacity. So it's just not going the right way. And the number of positive cases that we've been getting at the health department is pretty amazing. These are positive cases, and many of these patients are actually clinically sick, not sick enough to go to the hospital necessarily, but they certainly have symptoms.
Okay.
We've had 400 positive cases in the last 14 days, 266 of those just in the last 7 days. So this is just not a good situation, and we're seeing basically the same thing that they're seeing in neighboring states and throughout the general area. The Board of Health voted unanimously to direct me to write a mask mandate for Laramie County, which I have done and submitted to the State Health Department.
Okay.
They have not yet approved that. They're still looking at it, but I expect that they probably will approve it probably early this week. And I'll talk a little bit about what that will look like.
Now, Dr. Hartman, correct me if I'm wrong. I also understood that the County Health Board will take this up at noon on Tuesday. Was I incorrect in that, or what's the status on that?
We're going to have a meeting again on Tuesday at noon.
Okay.
And people can, it's a public meeting, and people can Zoom in, but I think questions will have to be submitted in writing, and we will answer as many of them as we can.
Okay.
And I hope to have that in place by then. I'll say that numerous other counties, in fact, just about all other counties in Wyoming, are considering similar measures because of the alarming rise in cases that they're seeing. The only other county in Wyoming that currently has one is Teton County, and we've used a lot of their language in our order, but they've had a similar mask mandate in Jackson for, I think, almost 2 months now. And by and large, in my conversation with the health officer in Jackson, they actually feel like they're getting fairly good compliance with that. And let me just point out what the other motivations for a mask mandate are.
Go ahead.
The first motivation is that we know that masks are very effective at reducing the rate of transmission of this particular virus that is transmitted person to person through the air. They are very effective. They're very inexpensive. They have very few, if any, downside, except for the fact that they're obviously inconvenient and annoying to have to wear, but they're not dangerous, and they're very effective at limiting the spread of the virus. Our goals in going to this length to get a mandate in Laramie County is twofold. First of all, we want to protect the welfare of the general public, and we also want to keep businesses and schools open. To keep everything open, we have to look out for the health of the people that work in the various businesses and establishments, but we also have to have a healthy population. This gets me to what this mandate will probably look like. And again, I know what I submitted to the state, but we'll have to wait and see what they send back.
Dr. Hartman, I do have to go into a bottom of the hour break here for about 2 minutes. If you want to hang on the line, we'll continue this conversation on the other side.
I'll be happy to do that. Thank you very much. I'll be here.
Thanks, Doctor. Appreciate it.
Thanks.
AM 650 KGAB, Cheyenne's #1 news talk radio station. You're in tune with the Weekend in Wyoming program. On the phone, I have Laramie County Health Officer Dr. Stan Hartman. Dr. Hartman chatting with us about a mask mandate that he's written and I guess submitted to the state already. Dr. Hartman, you were starting to tell us what this would look like. Go ahead.
Sure. It may not be what people are expecting. It basically has to do with people entering inside into retail or business establishments. The broad outlines are going to be that entering into a retail establishment or or a commercial business, public or governmental building, or any facility open to the general public. The mandate will require the management of those institutions to have, or those establishments to have, notices at the entrance stating that face coverings are required to enter, and it would also have a face covering requirement for people within those establishments that serve the public. This does not mean that people have to wear face masks outside when they're doing just general activities. I mean, you don't have to put a face mask on to walk your dog or anything like that.
Okay.
And there's also a requirement for people. There will be a requirement for people obtaining services at or visiting healthcare facilities, including hospitals, clinics, etc., dentists, pharmacies, and those types of facilities. There's just going to have to be signage on the doors that face masks are needed when they come in.
Okay.
If someone refuses to put a mask on, that doesn't mean that they'll be excluded. We see what happens at the grocery stores. For example, Albertsons, where I do a lot of my shopping. There's signage, and when I go in, I'm happy to see that the staff are all wearing masks. Most of the customers are wearing masks. I'd say nearly 90%. Families come in with small children that tolerate the masks. They don't seem to have a problem with it. And so it can be done. It's being done at the grocery stores. Walmart is doing pretty well with it. Sam's Club is doing real well with it. We see this at Menards and other stores, and I see it in a lot of small businesses too. The problem is that we also see a lot of establishments where it's not being done at all, and this really puts those businesses at risk.
Okay.
It's really to keep them open. This is basically a roadmap to keep people safe, keep the economy humming along. A lot of the small businesses are doing just fine. And the health department has no plans or intention to go into a lockdown. So I want to put that to bed right now. In fact, I don't know if you saw Anthony Fauci's interview on 60 Minutes last week, but he was asked under what circumstances would he recommend a complete lockdown, or how bad would it have to get before he'd recommend another lockdown. And his answer was very good, I thought. He said it would have to get really, really bad.
Mm-hmm.
What we really are trying to do is maximize simple public health measures to keep things open.
Mm-hmm.
That includes masks, social distancing, hand washing. We do contact tracing when somebody gets a positive test, with quarantine and isolation as appropriate. The thing that will close a business, and it's already happened here in Cheyenne in a couple of places, is if key employees turn positive, get the infection, and whether they develop symptoms or not, they get quarantined. If enough employees get sick or infected and get quarantined or are unable to work, that business can't operate.
Right.
So we really want businesses to do well. We all believe in capitalism and a free market, but we have to have people protected. It has to be safe. We got to stop the spread of this infection, because right now the trajectory is just not good. I have a little graph that I keep at my office, and it shows daily cases over the last 14 days. And I have a little trend line that goes through it, and that trend line is going upward at about 30 degrees of incline, which means that we're really not going in the right direction here.
Dr. Hartman, a couple of questions. Now, first of all, this is being called a mask mandate. Would there be any penalties in place for violating it?
Well, there's penalties listed, but quite frankly, we honestly do not have enough capacity to do any enforcement, so it's really going to have to be on the honor system.
Okay.
We're going to let establishments know what they need to do. It is still a public health order, even though we maybe don't have the means to go out and actually enforce it. But I look at it the same way as I look at speed limits. You know, speed limits are posted to keep people safe.
Right.
This order is going to be out to keep people safe. There are penalties allowed, but you know, we don't have the capacity to go out and look at businesses and see what they're doing. We're too busy doing testing, contact tracing, and other management. We just can't do that at the health department. And police and law enforcement don't have the ability to do that either. But we believe that just putting this mandate out there, whether we can enforce it uniformly or effectively or not, we think most people want to do the right thing, and they will.
So it sounds like it would be almost voluntary then. Am I misreading that?
Well, technically, it is an order. And as an order, I can't really say that it's voluntary.
Okay.
Speed limits are not voluntary, but
right.
Of course you can exceed the speed limit as long as you don't get caught or have a wreck. So technically it is an order, and it's technically a binding order, but just because we don't have a lot of enforcement capability doesn't necessarily mean that people should just ignore it.
Now, on the Teton County order, if I'm understanding it correctly, they did have some exemptions written in. Does your draft order have those as well?
It will have to be extended periodically. Right now, the Teton order has gone through its fourth extension, and I think they're working on a fifth right now. I'll see what the valid dates are when we get it back from the state. I don't know if they'll do it in 2-week increments like they do the state orders, or if it'll be longer. We'll just have to see what they say when we get back. I left the dates blank when I sent the template into the state.
Now, I believe the Teton County order did have medical exemptions for some folks. Does your draft have that?
It does.
Okay.
It absolutely does. There are exemptions for people who really cannot tolerate the mask. And let me say right off the bat that there are very few true medical contraindications to wearing a mask, but there are a few. And there are some people who, for various types of disabilities, mental health conditions, or other sorts of things, just can't tolerate the mask. So we're not expecting people that truly cannot do it to do it.
Okay.
If we can just get compliance up to a reasonably high level, we think that we can slow the infection down quite a bit. Some people that maybe should not wear a mask would include anyone who normally is short of breath, even on regular air. Certain people with certain types of chronic obstructive pulmonary disease, especially the ones that cannot get rid of carbon dioxide, probably should not wear one. Asthma by itself is not a contraindication as long as the person is not actually having an asthma attack. Some people with certain types of mental health conditions may not be able to tolerate a mask. People on various points of an autism spectrum disorder may not be able to tolerate a mask because they can't stand the tactile sensation on the face. So no, there's going to be plenty of exceptions in this. This is not going to be as draconian as people fear, but we do have to get compliance up to try to slow the spread of this infection, keep businesses open, keep schools open, keep the hospital from getting overwhelmed, and eventually we're going to get through this.
Now, another thing in regard to the Teton County mandate, as I understand it, it does apply to people in line outside of businesses and in things like taxis. Are those things included in our draft proposal?
Yes. Basically, in any location where people cannot adequately socially distance from people that are not normally in their household, they should have a mask on. And this applies to small confined areas like taxis, public transportation, cars for hire, etc. And the whole point of the mask is that, well, let me back up again and remind everybody, maybe people have heard this before, but it bears repeating. This disease is extremely contagious. It's transmitted through the air. Many, perhaps most people who get the infection don't necessarily have symptoms, or they get very mild symptoms, but yet they can spread it and they can project it. And the mask is what interrupts that flow of the air with the drops that carry the virus. So putting on a mask gives some protection to the wearer, but it also protects the people in the vicinity of the wearer.
Okay.
So really, putting on a mask is, in my opinion, when you're close to people that are not in your household, I think it's a gesture of respect. You're saying, I'm willing to put this on so that if I have this virus, I'm not going to give it to you. And then the reciprocal of that is, I really appreciate it if you would do the same for me.
Dr. Hartman, it looks like we have somebody trying to call in. Do you want to take a couple questions here?
Sure.
Good afternoon, caller. You're on the air with Dr. Hartman. Go ahead.
Hi. I'd like to address some falsehoods that I've just heard from Dr. Hartman. Earlier, Dr. Hartman mentioned that wearing masks does not have negative effects on people. I'd like to know where that information came from, because that's a direct falsehood. I'm going to call that lie out as the lie it is. There's plenty of studies showing both physiological and psychological negative effects from people wearing masks. And Dr. Hartman should know that. The other thing, I had a question for Dr. Hartman. He's stating there's people on ventilators here in Cheyenne. I'm wondering why that is, when there's also legitimate studies showing that not relying on ventilators has actually increased the survival rate by, I think it was like 50%. So I'm wondering why they're using ventilators here when it's been recommended not to. If he could give an answer to that, that would be great.
Yeah,
and my last thing is, why not stick to their proper role as a health official and give recommendations instead of orders? We are a free people, And I, for one, and I think most of my fellow citizens, aren't going to tolerate being ordered around. You have no place doing that.
Dr. Hartman, you care to respond?
Yeah, I sure do. First of all, I think this caller is totally wrong on both points. There is no serious harm from wearing a mask. I look at the medical literature all the time. There simply are no reports of people getting into serious trouble from wearing a mask. I've worn these for a lot of my career. Surgeons, operating room nurses wear them for their entire careers. They don't suffer any ill effects. It's just totally bogus to say that masks are dangerous. There's no credible literature out there that says that they are. And as far as people being on ventilators, people go on ventilators because they go into respiratory failure and cannot breathe. And in my career, I've taken care of a lot of people on ventilators. When I was working as a hospitalist, I would follow my own patients in the intensive care unit, and I put quite a few people on ventilators myself, and we just don't put people on ventilators unless they have to be on them, period. So this caller is totally wrong on both points. Is there another question from someone?
Yes, somebody sent me a Facebook message. This is actually a Facebook friend of mine. I'd like to know from Dr. Hartman what the end goal is. 0 cases, what specific number, and why such a concern for a number of cases when the mortality rate is declining. Our hospitals are not stressed out and have ample room for many more cases. 16 hospitalized and 3 in ICU is not taxing CRMC a bit. That's a question I was asked to relay to you from a Facebook friend of mine. What's your comment?
My comment is that some hospitals in Wyoming are maxed out. They do have to turn away other patients. And it's easy for this caller to say that 5 patients in the intensive care unit and 3 people on ventilators is not a big deal, but it is a big deal. These people would not otherwise be there were it not for this disease. That's just a fact. And the concern right now is not with the numbers as they are now. If we knew for a fact that this was not going to get worse, there would be no problem. We could just continue doing what we're doing. But the trajectory is up. We're seeing more and more cases. The case positivity rate in Casper is over 15%. That means over 15% of the cases of people that they test are positive. And one of the biggest problems that we have, and it's been illustrated by that first caller that asked me those 2 questions, there's a huge amount of misinformation and deliberate disinformation out there, and trying to pursue reasonable public health policies when so many people are misinformed and getting bad information from whatever source they're looking at is really putting us all at risk, and it's unfortunate and it's almost tragic.
Call 800-920-8484. 1-800-920-8484. That's 1-800-920-8484.
Station, you're in tune with the Weekend in Wyoming program. We're speaking with County Health Officer Dr. Stan Hartman. We're talking about a mask mandate. Looks like we do have another caller, and good afternoon, caller. You're on the air. Hello.
Hello.
Hi. Would you be able to ask Dr. Hartman to please address the fallacy of the masks increasing the rate of tuberculosis?
Doctor?
They do not increase the rate of tuberculosis. That's simply untrue.
Caller, was that what you had for us, or did you have an additional?
Yes, that was. Yeah, I wanted him to address that.
Thanks for the call. I appreciate it.
Yeah, there's absolutely no evidence to back any of that up. I've never seen a credible report of that happening.
Doctor, you mentioned that, it looks like we have another caller. Good afternoon, caller. You're on the air.
Hi, I have a couple questions for Dr. Hartman.
Go ahead. He's on the line.
Okay. We're in Goshen County, and we just have had, in the public school system, we had a big outbreak of strep throat. In the private school, the local private school, where a mask mandate is not in place, they did not have the instances of strep like they did in the public schools, where the mask mandate was in place. And so what I'm wondering is are the health department concerned at all with bacterial infections and stuff like bacterial pneumonia and that kind of thing? And if they are not concerned with that, why not?
I guess I'm not sure exactly what you're asking. We're always concerned with bacterial infections. Are you asking about bacterial infections related to masks, caused by masks, prevented by masks, or what exactly is your question?
As I understood it, I think she was asking if the mask increased the possibility of bacterial infections. Caller, is that an accurate summary?
Yes.
Doctor?
The answer is no. I've never seen a credible report of that happening. And again, medical people have been wearing these for their entire careers. We don't get bacterial infections from them.
Okay.
It just doesn't happen. I've never seen a credible report of it.
Caller, I appreciate the call this afternoon. Doctor, you mentioned there's a lot of bad information out there. Are people getting bad information off of social media? Is there a lot of assumptions going around? Why is there so much false information out there?
Well, there's a lot of stuff out. I don't know why there's so much out there. I have various theories, but I don't know if I need to go into them here. But some of the questions that were just asked are, I think, exemplify that sort of thing. Some of the things I've heard about masks that are just untrue. The one caller, and I've heard other people email me with this question, that masks cause bacteria to go into the lungs. They do not. I've seen that masks damage the immune system. They do not. I've seen that masks do all kinds of other pernicious, terrible things. And there's just no evidence to back any of that up. Now, some people may be finding what they call evidence, in quotes, various places on the internet and on various websites. You can claim anything in social media, but I look at the mask recommendations all the time on places like the National Institutes of Health, the CDC, professional organizations like the American Academy of Pediatrics. There is no credible evidence on any of those authoritative sites for any of the things that masks are accused of doing. And so a lot of it is just wrong information, but people get a hold of it and they run with it and they think it's true. And then when somebody like me comes along and says, well, no, it's not true, then it gets to be a credibility issue. But I'm just telling you that the masks are not dangerous, and there's a few people that shouldn't wear them, but by and large they're safe, inexpensive, and effective.
Doctor, we have about 45 seconds left. Any last thoughts or anything you'd like to reiterate for our listeners?
No. We just want this to be over quickly. Public health is tired of the pandemic also. We can't wait for it to be over. So we do understand the frustration. We understand that people are frightened and don't know where this is going, but we're here to protect the health of the general public, and we're using the best science available to do that.
Dr. Hartman, I appreciate your time this afternoon. Thank you for calling in.
Thank you for inviting me, and please invite me back anytime. Happy to be here.
I appreciate that.
Okay.